Good morning, people from around the world. My space secrets here with you on a Thursday, March 25th, 2010. The sun. Well, I'm looking out the window here. The sun is shining brightly over here in Oz for a change. How about that, people from Australia? For a while there, I thought it was gone altogether. It's like I was living back in England. But anyway, there is a lot of talk at the moment about this healthcare reform, and I can't believe that there is even some talking and debates going on here over in Australia. I'm just amazed. And I mean, we have to realize that we are now at a stage in time where we're living a lot longer than our ancestors, a lot more. The only catch with this is that as we age and get older, we get more susceptible to getting sick, injured, getting the flu, contracting diseases, etc. And the government know this. They know that they are going broke and they need money, and they know people are always going to get sick and spend money trying to fix themselves. I've already talked about this previously and in some of my newsletters. There are some estimates that vary, but reports indicate that over 30% of Medicare costs occur in the last month of a person's life before they pass over. And it's pretty interesting to note that those are extraordinary measures and they're taken to prolong one's life. Do you really believe government regulations will allow Medicare to refuse to pay for treatments that could, at least in some cases, save a life for 3, 6, 9, or 12 months? And that is an interesting point, but the dilemma I see is that the health insurance reform is far less than half the problem. Healthcare reform is necessary to truly address costs, and such reforms are not possible without trying to influence people to live differently, to change their diet, to exercise more. You hear all this on the news all the time. The same messages constantly. But people get desperate. They don't want to do this. They don't want to get off their asses and do things the hard way. Most of the time people are working, have kids, need to solve health problems quicker. So the government knows this and can capitalize on the fact that they can bring in new taxes, try to confuse people, give them more options, give them plans and complex things so that they don't need the fine print. That's where the tax comes in. It's just the small part of the new taxes the government around the world are going to bring in to make up for all the money that has been just printed out of thin air and the bad debt that's circulating. This healthcare reform law is nothing more than a political distraction designed to create more control over the average person and to take focus on what is really happening at the moment. The Federal Reserve banking system has robbed us blind over the last decade and giving money to people that don't need it. The national debt, most of which is owed to the Fed for using their worthless paper currency, has robbed many people of a stable financial future. And another fact is that $1,000 trillion in derivative contracts will lead to a major debt default, and eventually you will see inflation come in and hyperinflation after that. So if you don't believe me, just look at Argentina, what happened there when they defaulted on foreign debts. They lost the Falklands. Makes one wonder, doesn't it? Makes one wonder. Anyway, that's it for now. I'd love to know your thoughts and opinion on this. Hope you have enjoyed this video as much as I have enjoyed making it for you. Have a great day. I will talk to you all soon. Don't forget to leave your comments and check out our website on the right hand side. Okay, thanks again. Have a great day.